Houston, we have a problem. It seems that there's quite a bit of syphilis floating around in H-Town. I'm going to talk about that in this video. Hey all, before I get started, I have a quick request from this side of the camera. If you clicked on this video, please consider giving it a like, and also please consider subscribing to the channel. After all, why would you click on a video and not hit the like button? And why would you not subscribe to a unique channel like this with a unique content creator like myself? So please smash that like button and consider subscribing to the channel. Hello all, and welcome back to my channel. I am wearing a toxicology t-shirt today. Part of my training is in toxicology, and I perform the duties of a toxicologist at my 9 to 5. But today we are going to put on our microbiology hats, and we're going to look at some microscopic organisms, one in particular. When you're in the biomedical sciences and when you've been trained in the biomedical sciences, there's a lot of overlap between disciplines. So I do have some familiarity with microbiology. I want to shout out Adrian. He shared this in a group, and I said, whoa, well, this is a novel science and technology topic. This is a current event. This would count as science news. So I thought it would be interesting to cover it here. And this will be one of the many pre-records I make for August 2023, as I intend to take a break from live streaming in August. So with that, let's jump in and let's read about what's happening in Texas. So first of all, before I jump into this article, and several will be below in the description box, in terms of microbiology, everyone keep in mind that there's a difference between a virus and a bacterium. And in terms of their complexity, their complexity as an organism, a virus isn't actually an organism. It's not technically alive like a bacterium is, but their sizes are different. So a viral particle is significantly different than a bacterial cell. This article comes from Health, and it is entitled, "What the Syphilis Outbreak in Houston Says About the Spread of STIs." This was written by Lauren Higgins, and it was published on July 24th, 2023. I'm skipping over the fun facts. The Houston Health Department recently reported a syphilis outbreak that is responsible for a 128% increase in cases among women, as well as a 9-fold increase in congenital syphilis in Houston and Harris County, Texas. The spread is among a larger outbreak of sexually transmitted diseases, with syphilis cases rising nationally by what the Centers for Disease Control and Prevention called an alarming 32% from 2020 to 2021. In response to the outbreak, the Houston Health Department is waiving all clinical fees for sexually transmitted infections at its health centers and will expand the use of its HIV/STD mobile clinic to increase the number of community screening sites. While the rising number of cases may be, experts agree that these statistics could largely be due to the COVID-19 pandemic's stress on health care systems. Public health services were already struggling, But with the added stress from the COVID-19 pandemic, services related to education, testing, tracing, and notification about STIs, such as syphilis, became more difficult. Amy Marciavsky, DNP MSN, and Texas A&M University Central Texas Department of Nursing Director and Chair told Health. Marciavsky explained that COVID-19 testing, treatment, and containment was the priority for a majority of medical funding and resources. Many patients haven't received reproductive screenings and care due to clinics being closed. Without being diagnosed and treated, patients could be spreading the infection without knowing it, she said. When syphilis goes undiagnosed. Syphilis is a bacterial infection usually transmitted from skin to skin contact through vaginal or anal sex. While less common, it is possible to get it from oral sex. According to Marciavsky, direct contact with a canker sore is the primary way to spread the infection. Screening tests for syphilis usually include either a rapid plasma region. Let me read that again. Screening tests for syphilis usually include either a rapid plasma reagin, RPR, I think I pronounced that correctly, which is a blood test for a venereal disease research laboratory, a VDRL test, which can be done on blood or spinal fluid. Syphilis typically develops in stages, with the first stage involving painless sores on the mouth, genitals, or rectum. The sore will last 3 to 6 weeks before the patient receives treatment or not. If left untreated, those sores will heal, and the second stage is characterized by a rash. When it's caught early on, syphilis is easily treatable with antibiotics, typically penicillin. If the patient has had syphilis for a longer period of time, or it's in the secondary or later stages of syphilis, they will need 3 injections of antibiotics at weekly intervals. Without treatment, the infection can lie dormant in the body for years or even decades before attacking the brain, nerves, eyes, and other organs. While rare, it can cause deafness, blindness, or death. There is a stigma around seeking treatment for STIs and a lack of access, especially for younger people or those without health insurance, said family physician Alex McDonald, MD. Often the initial ulcers are painless and heal on their own, and people simply are not aware of the importance of being tested or evaluated. McDonald recommends correct and consistent condom use to significantly reduce the risk of all STIs. A rise in congenital syphilis. The recent rise in syphilis cases in Houston is mainly attributed to pregnant women who passed the disease to their babies. This is referred to as congenital syphilis. In 2016, there were only 16 reported cases, but in 2021, that number jumped to 151 cases. Congenital syphilis can be prevented, but requires testing a pregnant woman for syphilis right away. Pregnant mothers should be testing during their first prenatal exam and at 28 weeks, said Marciavsky. If the mother lives in an area with a high rate of syphilis, the screening should be repeated at delivery. Treatment depends on the treatment status of the mother plus clinical, laboratory, or X-ray evidence of syphilis in the infant. Typically, congenital syphilis and syphilis is treated with antibiotics. And if the mother tests positive, a shot of penicillin is given to her up to a month before delivery to make sure the baby is born healthy. If the infant is diagnosed, a regimen of penicillin G will be needed, said Marciavsky. In addition, depending on the symptoms, the infant may need more treatment and testing. If left untreated, syphilis in pregnant women can cause miscarriage or stillbirth. According to the CDC, 40% of babies born to women with untreated syphilis can die from the infection as a newborn or be stillborn. How to protect yourself from syphilis. Because syphilis can go undetected, it's important to take preventative measures to ensure you and any sexual partners are safe. Regardless of a syphilis outbreak in your area, McDonald recommends always practicing safe sex. That includes wearing condoms, limiting the number of sexual partners you have, and routinely getting tested for STIs. If you think you've been exposed to syphilis or begin to notice symptoms like sores on the mouth or in the genital area, seek testing or medical attention as soon as possible. This will reduce the likelihood of transmission and severity of treatment needed. Pregnant women should speak with their healthcare provider regarding their recommendation for prenatal testing. This is critical to see if the fetus could have been exposed to syphilis, said McDonald. For babies who have contracted syphilis, treatment consists of penicillin IV for the first 2 weeks of their life. It's also important to wear condoms and practice safe sex during pregnancy. If you learn that one of your sexual partners has or may have syphilis, tell your doctor right away so you and your partner can be treated and your baby can be protected. If you test negative during your first or second trimester, you may need to be retested at the start of your third trimester and at delivery, depending on how common syphilis infections are in the area you live in. So this article is going to be below in the description box. As I was thinking about shooting this video and covering this topic, I was thinking that over on my original channel, I did record a video on an excerpt from Malcolm Gladwell's classic book, The Tipping Point. And there is, in fact, an excerpt, and I think I read this and recorded it and uploaded it. And if that's true, I'll leave the link in the description box below. He talks about how epidemics like the syphilis, I believe it was syphilis, the syphilis epidemic in Baltimore spread. So whenever something like this is spreading like this, there are often conditions in place that are facilitating it or allowing this to happen more as readily as it is. So a part of it probably has to do with it being the summertime. And I suspect that during the winter time, well, depending upon what kind of winter they have in Houston, when people can't go out as much, you'd probably see the numbers like this die down. So there are a number of factors that lead to spreads like this. So again, I'll leave that in the description box below. But again, this is a science and technology topic. This is science news. And if you are in that area, and even if you are in one of the other major metropolises, be careful and be safe because, well, you never know. You never know. You never know when it's your time. You never know if you're having relations with someone. You don't always know where they've been. So be careful out there. Let me know what you think in the comments section below. Let me know if you have any questions, comments, or jokes, or anything. Once again, we put our microbiology hats on today. So that involves bacteria, it involves viruses, it involves other things as well. But once again, I was talking to a friend. The reason I mentioned viruses being different than bacteria at the beginning of this video is because I recently had a discussion with a friend about that, and they're not the same. And sometimes I think antibiotics are prescribed to treat viral infections. I don't know why that would be, since bacteria are not viruses, but sometimes people conflate them, and a virus and a bacteria are different. Also, yeah, I think I'll stop that there. I was going to say something else, but I'll stop that there. if you look at some of the articles I shared, I think there are some visuals of the rashes that were described in the video, and some of the images. You could just do a Google search to see what syphilis looks like on adults and teens or whomever. They're not pleasant images, but maybe those will scare you into not catching it yourself. In any case, this is Big Discussions 76, Science and Technology. My name is Dr. Anwar Youssef Dunbar. Please like, share, and subscribe if you want to donate something to the channel. That information is below in the description box. Also, please consider joining the Big Words LLC Newsletter. In addition to being a YouTube content creator, I'm also a writer with 2 blogs and a book project on the way. And with that, I'm going to stop this. So everyone, stay safe out there. Once again, be very careful. And as always, remember that your attitude determines your altitude. Always try to do your best. Take care, and I'll talk to you the next time. Bye-bye.